Hi, welcome. Welcome to Penn State Harrisburg's Select Medical Simulation Lab. I'm Patty Fitzgerald, and I'm the Clinical Simulation Skills. Hi, welcome. Welcome to Select Medical Simulation Lab at Penn State Harrisburg. I'm Patty Fitzgerald, and I'm the Sim Lab coordinator for both the Accelerated Second Degree and RN to BS programs. I'd like to take you on a brief tour today through our really wonderful lab. This is where our nursing students spend a great deal of time, clinical time, practicing their clinical skills as well as participating in simulations. We have 2 simulation rooms that have what we are mannequins, our high, medium, and low fidelity mannequins that are part of our simulation scenarios. We also use actors to help our students learn in practicing skill development as well as being part of difficult scenarios or what we call high stakes scenarios where patients will require a tremendous amount of care and spot on care where we want to eliminate mistakes, and by exposing students to those situations here in the Sim Lab, it gives them an opportunity to learn in a safe environment. Here in our lab we have 4 fidelity mannequins. 3 of them are here in our bays, and they are always out for students should they need to come in to practice or want to come into practice, as well as we use them for assessments such as lung sounds, heart sounds, and more complex skills as well as for example, IVs and insertions and suctioning. We have a high fidelity mannequin that I'm going to show you shortly, and his name is Ted, and Ted is, we call him high fidelity because of his ability to portray more lifelike human realistic qualities, so we'll show you that in a minute. Here are some of our mannequins. No, they actually don't bite, but we have newborn mannequins that our students are able to utilize to practice assessment skills, learning how to diaper, swaddle newborns, administer medications, and check head circumferences, things like that. We also have child-sized mannequins that allow the students to practice giving injections as well as doing physical assessments on these mannequins. Over here in our bays, we have 4 bays. All equipment in the bays are functioning. They are all state-of-the-art and current with what any student would see in a hospital or acute care setting. These are our mannequins, and they also participate in skills learning. Students practice on mannequins as well as sometimes actors and themselves. And we use these mannequins in simulated events so that students can learn how to, for example, accurately take a blood pressure, take a pulse, accurately talk to a patient and take personal history. These mannequins are capable of miking them, and they can talk back to the student in a learning situation. I'd also like to take you here to this area where we have our other mannequins that we use for learning purposes. They're called Chester chests, and they are a much more intensely complex type of a model where students are able to practice administering IVs in surgically implanted type IV access ports. And lastly, I'd like to take you to one of our simulation bays where sims are conducted with a higher functioning mannequin. That sounded terrible, but okay. Yuck.
Didn't take the camera with you.
What's that?
Nice.